got Damien Wilde with me. He's going to introduce himself in a moment. You might know me. I'm Dr. Val Fraser. I'm co-founder of Safer to Wait, education specialist, and I'm particularly interested in what's going on with schools and children. And I'm here to talk to Damien today about gender questioning children. So Damien, could I ask you to introduce yourself?
Yeah, sure. Hi, Val. Nice to be here. So I'm Dr. Damien Wilde. I'm a consultant clinical psychologist. Started my career as a primary school teacher. So I have lots of experience in working in schools. And as a clinical psychologist, I've done a lot of work in CAMHS services, child and adolescent mental health services. Now I work in private practice with my practice, which is called Wilde Psychology. And I work with children and young people, do some work in schools, and also work with adults providing psychotherapy.
Great. So we're here talking about gender questioning children and both our experiences of it, but obviously I want to ask you about the psychological aspects of this. And we are in the backdrop of a recently published Cass review. Dr. Cass has done this 4-year thorough investigation, more than 100 different research studies, the first in the world, and an authoritative review has come out actually asking us to question, as educationalists, as medical professionals, as psychological, as parents, just to question what has been happening almost by default. So with that as a backdrop, I'd like to ask you some questions concerning your experience and also your subject knowledge about what might be some good practice. And because we're on a Safer to Wait platform here, I'm particularly interested, and I'll steer you towards the end on that, on what we might advise parents to do who are completely, in my experience, puzzled as to what is the correct approach with their gender questioning children. So if I could ask you first of all, Damien, and not necessarily confine yourself to children at this stage, why in your experience do people often want to change gender? We know that it's sometimes temporary, and in children it's overwhelmingly a temporary period. But why in your experience do you find that they start to question and go down that route?
Yeah, it's an interesting question. I'd just like to add, just before we start, I think it's good that we're having these conversations because we've seen GIDS closed, we've seen puberty blockers banned for children, and as you said, we've seen the Cass review. This is creating conversations so that people are not scared to speak out, because this is an important, critical matter, and we should be able to speak up. I was trained to do that, to be analytical and have a freedom of speech to talk about, you know, such important and critical issues. In answer to your question there, in my experience of having sat with a number of children and adults in the psychotherapy space, I see people wanting to change gender as a psychological defense. Okay, so I'll give you an example, and I'm not saying this is the case for every person who wants to change gender. But so I've seen people before in the therapeutic space where they've experienced a traumatic event in their life. So, for example, childhood sexual abuse. And so if I had a girl who was coming to see me, the horrors and the trauma and the horrificness of such an experience has led them to experience psychological distress at such an overwhelming level, and that they can't sit with that distress, is there is a need then to get away from themselves and reinvent themselves in a way. So I think sometimes young people and adults see this as a solution to the distress and the struggles that they feel. No doubt, particularly children, you know, at a young age, their brains are still growing, their identity is developing, and there's so much for them to navigate and to think about. What are things like in the school environment? What are things like with peers? What are things like in the home environment? Are the struggles with the dynamic between the parents and everything else that's going on? So when they may be struggling with their identity in some way, they may think, okay, this is a solution. Maybe I'm the wrong sex, the wrong gender, however you want to phrase it, right? Maybe that is a way for me to feel better. So they see it as a solution. So I would say, in the main, I see people who want to change gender, that it's a psychological defense.
Great. And it kind of fits with my experience. As you know, I also work with some gender questioning children. And I want to acknowledge your point about the toxicity of debate that's been around this area, which Cass herself draws attention to in the publication of the review. We need to be talking about this, and yet it's almost been a taboo subject where people have been too frightened to talk about it. And we mustn't, because we're here protecting the most vulnerable people in society, our children.
Yes.
And I also, just to confirm what you said, I had one case of a child who was a looked after child. And of course, Cass draws attention to the fact that that category of children is overrepresented in the gender questioning children. Okay, so we know that there's that context for
extremely vulnerable group, and also
a
group that's suffered extensive trauma.
Yeah, and one particular child not only looked after, but was sexually abused, but decided if she were to transition to a boy, it would protect her, because she didn't observe that that was happening to the other looked after children in that particular context who were the other gender. Anyway, she did have a very sensible parent who did exactly what you did in terms of questioning where is that coming from and so on. Okay, so I, as you know, work in education, sometimes working with them, some vulnerable children, some vulnerable teenagers. 7 years ago, I didn't come across any gender questioning children. And within the last 6-7 years, I've probably had about 40. And I want to ask you, what do you think is the cause of this massive increase that we're seeing in children who think this is a viable pathway for them?
I mean, the first thing which springs to mind to me is that, a couple of decades ago, for example, is that it wasn't really a widespread and viable option which was on the table. So, if you had a child who was thinking, oh, it feels really uncomfortable being a boy, I'm not sure I want to be a boy, and they're confused about their identity, or maybe they've experienced some trauma and they're struggling psychologically, they're confused, they don't know what to do. And that option wasn't very readily available, right? So I think a young person and the family and health professionals involved, I think, would seek other ways to resolve the situation of a person's identity struggles. And they would maybe, implement other interventions or other support systems or avenues. Now, I think as this has become more readily available, I mean, first of all, you have to ethically question publicly and privately people who are pushing this, because it creates for certain people a lot of money. And we kind of see that with certain kind of medical groups and the pharmaceutical industry and all of that. So I think, that could be one reason for the rise. And the other reason in terms of the rise being increased and exacerbated is, the use of the internet, social media, and ideological groups. Because, of course, people witness to kind of, videos, articles, conversations. And if someone is feeling a little mixed up, a little vulnerable, and they feel unsafe and they want to sit within a group, a young person or an adult might think, well, actually, that feels like that's the group for me to sit in, right? And I think you also see these, this social contagion has grown through the pressure from ideological groups, and schools, universities, organizations are feeling the pressure because, in my experience, they're obsessed by corporate image, and they want to be seen to be doing the right thing in case they draw criticisms. So you get ideological groups like Mermaids and other such groups We then put pressure on these organizations to have policies, to have kind of certain days, and to incorporate into curriculums and working days and all of this. So I think the awareness is much greater now, and it's pushed by people, pushed by adults who I think have their own issues, which they don't have an awareness of, and so then they end up projecting it onto children and other vulnerable people. And this is, a clear safeguarding issue.
I want to agree with you that obviously you have quite a lot of experience of how schools are operating, and these third parties that are coming on are not politically neutral. They're not there asking children to critically evaluate their materials. They're asking them to accept them, and therefore accept who they are. And you're targeting children at a very vulnerable stage. So my experience is that teachers don't generally get involved in this kind of thing. It is these third parties. And in fact, many of them don't feel skilled, and others don't actually feel very comfortable with this. And yet, why are we asking our children to sit through this if the staff in schools are not delivering it and are not necessarily expert? How key is all this information?
It's a dangerous experiment.
It's a captured audience, isn't it? And we've got to question that. We've got to question if it's not delivered by trained teachers, if the trained teachers themselves do not feel fully equipped with the ideas and concepts, and with their training of how to encourage critical thinking so that children do have this voice, then we're selling them out, really, aren't we? Okay, so I suppose we've kind of covered the question about how might it have manifested in the past. I think you did that when you covered that one. So can I ask you then, what's your advice for the wise parent? I come across parents who are there saying, what can I do? And I'll tell you what I sometimes say, but I'd like to hear. I sometimes say, well, your child is clearly in distress when they feel this out of sorts between their body and who they think they are, but also understand, and I'm sure you'll agree, whoever thinks of adolescence as the golden years, we're all in choppy waters during that time. So I ask them to, sit with it, but the child is clearly in distress. They need you. They need you, and what resists persists. So, yeah, if you could give me even more advice on how I can advise parents, that would be useful.
Yeah, I mean, I think you make some excellent points, Val, and I'm going to amplify and add to that. I think, first of all, it's important to acknowledge that this is complex and difficult, and nobody is saying that it's an easy decision or an easy process with what's going on. As you said, the development during childhood is a difficult time. I often even say to adults who are seeing psychotherapy sessions, people, situations in the world is often a difficult place to navigate at the best of times, right? So first of all, I think the key bit is in understanding why. Okay, so if a boy says, "Oh, I want to be a girl," okay, or a girl says, "I want to be a boy," okay, I think is, rather than just latching onto a parent saying, "Oh, okay," because sometimes parents want to do what's best for their child, and they don't want to ignore them or dismiss what they're raising. So sometimes they might jump in to say, well, okay, fine, you're a boy, but you want to be a girl. Let's go to the GP and let's start that process. And then we have these kind of psychiatric labels, gender dysphoria. Let's try and get away from the labels. Okay, so we see all kinds of other labels as well as gender dysphoria pushed on the internet, non-binary, trans, and all these kind of, I think I saw a page sheet once with about 40 different types of identities and kind of sexual ways of being, and I just think we have to get away from labels and we have to think about the person individually. Okay, it should be about them. Okay, But so I think the why bit, if we get away from labels like gender dysphoria, because some people might say, oh, my child has gender dysphoria, and because they have this, mental disorder, that means they have to change sex, doesn't it? And it stops the curiosity, right? It stops the gentle, non-judgmental curiosity. So I would say that parents, in a gentle, calm, and non-judgmental way, is just foster a little bit of curiosity about why. Now, a child might be unsure. Often, is the case is if there are psychological defenses at play, then they're unsure. So parents can have those conversations, okay? If having those conversations doesn't kind of create enough curiosity and understanding, sometimes that might be enough where a parent's supporting. I think containment is really important as well, because you said a lot of these people are distressed, right? So that kind of containment where the parents are being really supportive and they're soaking up their child's distress. They're showing an understanding about, yes, I know you're struggling, right? So that can be hugely beneficial. So I think all of that is important. But yeah, I think if they're struggling with understanding why, that is then when health professionals can hopefully step in. So, you got certain kind of NHS services, like I mentioned, CAMS earlier. So, it could be that the child could benefit from a space, and the family, with a psychotherapist or a clinical psychologist, where they can actually, if the parents and the child are unsure about, okay, my child has said, I want to change gender, is they can create an understanding of why. Okay, so in clinical psychology, we call this formulation. We use formulation instead of diagnosis. Okay.
Yeah.
So the more this is understood, then the more likely you will know what to do.
Yeah.
Okay.
And hopefully, following the CAS review, those in the medical field, psychological field, will have a better set of guidance, which isn't, immediately fast tracking them onto, sort of some permanent solutions in inverted commas, I want to say.
Exactly, because if you go with the label gender dysphoria equals puberty blockers equals surgery. There's your kind of pathway.
Yeah.
But actually, a formulation takes more time, right?
Yeah.
But a good formulation informs an intervention.
Sure. And it's interesting, isn't it? Because again, the parent will be under some pressure, or has been. Hopefully this will change, to affirm this child's decision and immediately to start what might be what Cass called, Dr. Cass called, social transitioning, names and pronouns. And again, clothing and so on. And I guess my advice is always for them to understand that this is not a neutral act. This is a socially it's an impactful intervention, which Cass herself identified often leads to more medical interventions later on, because you're kind of facilitating this. So if you can put the pause button on, and if you can do as you say, just a question. And also, I don't want to go back to the 80s and gender stereotypes about how I've got to be a girl to be this, and reassure your child, whoever they wish to be, it's not necessarily another person they have to create to be who they want to be.
Yes, and the thing is, it is all about identity. Life is, as a child or as an adult, it's often about identity. And that's what I was saying before about, rather than, identifying yourself as, well, I'm trans, or I'm this, I'm that. It's actually, what we've got away from is, okay, this is Sarah. She likes sailing. She likes spending time with her friends. But at the moment, she's kind of struggling with her identity in some ways. Oh, this is Ben. He likes rugby. He likes kind of quiet nature walks. Let's actually think about the person and their identity and who they are. If there are aspects of our identity or their body that they're not happy with, let's have those kind of conversations. But we must be mindful not to jump to extreme changes, because trying to change gender, having, taking puberty blockers, which, people have to take, I think kind of certain injections have to be taken for the rest of the life, right? And also kind of surgery. This is an extreme solution, right? Which could be fraught with many physical and psychological difficulties. It's also extremely expensive. And we can't just at the click of a fingers say, I don't know, if a child said, well, I absolutely hate my arm, it's really ugly. Well, do we give them a new arm? No, we'd actually sit with a person and think, as you said before, it's about sitting with things, about sitting with who a person is. And there should be some time in a comfortable and safe and non-judgmental way, whether it be just with parents or with professionals involved, in helping a child or an adult sit with themselves and who they are and explore and be honest and say, well, I'm not happy about this part of myself. I hate this part of myself. Or I'm experiencing shame about this. Let's help a person sit with that and work through it.
Well, that's a perfect point to conclude on, because, of course, we are on a platform, Safer to Wait. And that's exactly what our brand, if you like, is trying to get across, that so much of what's happening to childhood is we're pathologizing it. We're putting these labels, which we feel is fixed. And once you've got this label, this syndrome or this behavioral thing, you're no longer an individual. You can't do anything about it. You've lost all control because you've got this thing. But it's much
It hinders
safer.
Identity.
Yeah, it's much safer to wait until you've navigated the choppy waters of adolescence and growing up. Then you can make those choices, which, again, going back to Cash, she found overwhelmingly it was a temporary phase for people. Well, it's not temporary if you've made a permanent intervention and you've got to live with that for the rest of your life. You might regret it, but you can't actually reverse some of those procedures.
Yeah. That's why an exploratory psychotherapy space can be helpful. And it's really important to know, in case people incorrectly throw this in, that this is not conversion therapy. What we're talking about, if somebody with consent would like to sit in a therapy space and explore their struggles and their distress, that is afforded to them.
That's a really good point to make, actually. This is not about conversion therapy at all. It has no parallels with what we might have found 40, 50, 60 years ago. Damien, thank you so much. That's so insightful. And I think our parents viewing this would be interested. And of course, we'll give them your contact details if anybody wants to contact you further.
Yeah, if people want to get in touch and have some questions or want discussions, there's also the article that I wrote on the Heart website, because
we will link to that. We will link to that. Yeah. Okay, Damien, thank you so much.
Thank you, Val. Cheers.